Hi everyone, my name is George Tilston and I'm a data manager at the Manchester Biomedical Research Centre. My role involves a lot of locating and accessing various data sets to make them available for medical research. I presume that, like myself, many of you have searched for a data set at some point during your career. Your experience has no doubt varied considerably, as the ease of finding and accessing data sets depends on many factors. I'm going to present a study which investigated whether researchers can assess the suitability of data sets for their research questions with metadata only. If this title doesn't quite make sense at the moment, hopefully it will be clear after the next couple of slides. The tool we chose for this study was the Health Informatics Collaborative, or HIC for short, metadata catalogue. The HIC aims to develop national research databases comprising data from several trusts. We already have connections with the tool's developers at Oxford University, so they could assist us with populating our own instance of the catalogue. On the slide, you can see an example dataset displayed in the catalogue, which provides data item name, description, and data type. To give you an idea of what the participants were asked to do, here is an example of one of the research questions. The question relates to the Salford Integrated Record, which is an electronic health record database and one of the 5 databases used in this study. Here you can see a screenshot of the metadata for this database. To answer this question, the participant needed to work out whether the information needed was available. In this case, medication data was needed for statin prescriptions, and diagnoses were essential to find hypertension patients. There is also data on symptoms and examination results, so outcomes can be compared across patients. There are various challenges involved with finding and accessing healthcare datasets. Even if the location of the data is known, it's still often unclear which data points are included, and hence it's impossible to know if it is suitable for your research question. There are many issues related to this. A researcher could decide to collect data themselves that was available elsewhere, thus wasting time and effort. Alternatively, they may spend time accessing a dataset that turns out to be unsuitable. Both scenarios are examples of time and effort being wasted due to a lack of specific information about datasets, a concept widely known as metadata. The FAIR data principles were defined in 2016 with the overall aim of enhancing the reusability of data, and these were a key driver for this study. The aim of the study was to find out to what extent researchers can assess the suitability of datasets to answer research questions using only metadata. Hopefully this makes a bit more sense now that you've seen one of the example questions. We know that metadata catalogues and other similar tools exist for the purposes of improving the findability of data. However, it is unclear how effective these tools are. The main objective was to compare the average assessment accuracy to the predefined success rate. We chose 90% for this, meaning that 9 out of 10 total assessments made would be correct. This may seem high, but given that the purpose of metadata is to describe the information contained in a dataset, it should be clear in almost all cases whether a dataset is suitable based on the metadata. The secondary objective was to reveal aspects of the chosen metadata catalogue tool that could be improved. Given that these tools are relatively new, they are not expected to be perfect. If we can better understand which features help researchers to assess datasets and reveal any features that are lacking, the effectiveness of these tools can be improved. 13 participants were recruited from the University of Manchester via faculty updates and social media. We considered lecturers, postgrads, research associates, fellows, or academic researchers with at least 3 months of experience working with health datasets. To populate the catalogue, we used 5 patient-level datasets related to Greater Manchester projects from the Connected Health Cities programme. These datasets, which you can see on the slide, represent a range of healthcare contexts and data structures, from cohort studies to electronic health records. I met with each participant and asked them to provide some basic information about their job and experience. I then assigned them 2 of the 5 datasets, excluding any that they have used before. I provided them with a laptop where they could browse the HIC metadata catalogue and familiarise themselves with the tool. For each dataset, 5 research questions were designed by the study team in collaboration with the data custodian for that dataset. This collaboration was important as it was the data custodian that provided the gold standard answer of whether each question was answerable with the given dataset. Once 5 questions had been assessed for the first dataset, the process was repeated for the second. Finally, the participant was given the opportunity to provide feedback on the tool. Overall, 13 participants assessed 10 questions each, 5 per dataset. Out of 130 assessments, 87 were correct. Bear in mind that an assessment was only marked as correct if the participant matched the gold standard answer of yes or no, and also provided a justification of why it was unanswerable, or the correct data fields to use if it was answerable. The majority of participants had at least 2 years of experience in health research, and most of them had either a master's or a PhD as their highest qualification. The overall success rate was 67%, but as you will see on the next slide, many of the incorrect assessments failed to simulate a real-life research scenario. Out of the 43 incorrect assessments made by the participants, 21 of these were considered as failing to replicate a real-life research scenario. On the left-hand table, these categories are the bottom 3 rows, highlighted in grey. It is unlikely that a researcher in real life would misunderstand their own research question, though I'm sure it must happen in some cases. It is also unlikely that they would lack the knowledge to assess a potential dataset's suitability. These categories were removed from analysis and the resulting success rate was 80%. Some basic analysis of the results revealed slight differences in the accuracy of assessments across the different datasets. The Salford integrated record had much greater variation in assessment accuracy and also the lowest average accuracy. This may be explained by the fact that it is a complex data structure of electronic health records that some researchers may be unfamiliar with. Within the participant feedback, a common suggestion was that the search functionality of the catalogue tool could be more efficient. Currently, the tool only provides results that match exactly what the user types in. Participants suggested that a useful functionality would be returning synonyms to any term that is typed in or predicting terms as a user types. Given that the success rate was 80% and even less before excluding some categories, it's clear that the predetermined rate of 90% was not met. The metadata catalogue, which was manually constructed in collaboration with data custodians, was insufficient for researchers to assess dataset suitability with high accuracy. The most common reason for an incorrect assessment was the inability to find the relevant information in the catalogue. The improvements to the search tool, which I previously mentioned, would help to increase the findability of individual metadata items, thus reducing the number of incorrect assessments. Future research in this area could include testing the catalogue with a group of researchers rather than individuals to better reflect a real-life research scenario. Secondly, in reality, metadata is often generated automatically by a machine. It would be interesting to observe the differences in assessment accuracy between this type and manually created metadata. Finally, the metadata could provide more specific information such as data item completeness, which wasn't available in this case. I would like to thank the chair of this session and to EMEA for inviting me to present this study. And thank you to everyone for listening. If you would like to get in touch, please email myself or Professor Neil Speak. The details are on the slide. Thank you.